So just to give a background to this series, we've got a series of four events like this which we'll be running. The first, obviously, remote consultations, and the others in no particular order are on responsible prescribing, circular economy in healthcare, and whole person care for sustainability. So this series of 4 virtual events is funded by the Health Foundation. The aim of this is to increase collaboration in the field of sustainable healthcare. And now some of that collaboration will come about in events like this, and the reason for the urgency really is obviously the urgency of the climate crisis itself, but also this document recently produced in October, delivering a net zero for the NHS, which is a strategy that was set out to achieve that. And really a lot of this collaboration will focus around the Q community, which is a group of an online community of a group of healthcare professionals of all different types who are involved in QI. So we urge you to, if you're interested in QI and involved in it, to join the Q community. And they have a set of special interest group, one of which is that for sustainable healthcare. So it's a great place to collaborate. I convene it, and we see a lot of collaboration interaction there. So really encourage you to get involved. So as we run through these different events, there'll be a couple of sort of concepts which are threads running through them. And the first of those is the principles of sustainable practice, which our medical director, Frances Mortimer, laid out. Really with obviously the overall aim is to reduce the impact on the environment without reducing health outcomes. And to do those things, we can either reduce activity or reduce carbon intensity. And these sort of principles they're not unique to sustainable healthcare, but this cluster is I would say unique to sustainable healthcare and really useful in thinking about what solutions you might come up with. So it's obviously prevention, so primary and secondary prevention, self-care and empowerment of patients and staff, I think as well. Lean pathways, so making every step count within your patient journey and your processes. Low carbon alternatives, so we're looking at digital today. Is that a low carbon alternative? Sometimes it is and sometimes it isn't, as I'm sure we'll discover. And then operational resource use as well, so that's about kind of the stuff that we use. So we'll be illustrating those as we go through, but just to let you know about the sort of conceptual background to this. And the second big concept that we look at is sustainable value. So here we're thinking about, obviously when we look at sustainable value, we're wanting to deliver the best outcomes for patients and populations, not just now, but in the future. And thinking about, are we wanting to do that with a minimum cost to the environment, with a minimum financial cost, and building in social value at every point. So that is the other, and this is very useful when we come to measurement as well. So these are the key concepts which will run as a thread through this series and certainly through this section now.